So let's dive into the concept of repair. So what does Joan need in terms of repairing her gut lining? So we need to determine, the need for an elimination diet, the need for pre and postbiotics, and so on. And so we did that in the last section, but now we're going to dive into sort of a foundational GI repair protocol. So we've talked about the elimination diet. We've talked about probiotics. Let's dive into vitamin D for a minute. So vitamin D decreases inflammation. It downregulates nuclear factor kappa beta or NF-kappa B. And it increases IL-10, and it decreases IL-6, IL-12, and so on. And then in terms of inflammatory bowel disease risk, vitamin D deficiency may compromise the mucosal barrier, leading to increased susceptibility to mucosal damage and increased risk of IBD. So the therapeutic dosage is maybe dose-based, but I would argue it should be laboratory-based, and you really want to get that dose somewhere in the vicinity or above 50. And an acute protocol might be to use 50,000 once a week or even twice a week for 8 weeks, and then recheck a vitamin D level. So if 25-hydroxyvitamin D levels are not normal after that 8-week, continue the protocol and recheck serum calcium and vitamin D every 2 weeks, reevaluate intestinal absorption and efficiency. So what about omega-3 fatty acids? Well, omega-3 fatty acids appear to exert a very significant anti-inflammatory benefit by suppressing NF-kappa B. And also they act through the PPAR alpha, reducing pro-inflammatory mediators. When endoscopic endpoints were used to evaluate the role of fish oil in the treatment of ulcerative colitis, 3 of 3 studies showed statistically significant improvement in the group on fish oil. The safety of fish oil supplements is very high. And in fact, doses up to 3 grams are thought to be safe for the general population, even those on anticoagulants. When you move above 3 grams, you probably need to start to be a little more cautious. Here's some dosing ranges for omega-3 fatty acids. The bottom line, I think, an important rule of thumb is, again, these 3 grams a day are really thought to be safe. It's used up to 20 grams a day, but when you move above that 3rd gram, you need to start being a little cautious. Make sure that the person doesn't have a bunch of bruising or difficulties. I will tell you that I use these very high doses commonly. In fact, we get people off of biologics for their inflammatory bowel disease using this combination, this 5R approach. And I often have them on very high doses of fish oils to start. And I have not really seen bleeding complications. So here are some references to omega-3 red blood cell levels. And so the red blood cell fatty acid composition reflects long-term omega-3 fatty acid intake. And my goal is always to get people to 10%. This is called the omega index. And it's the percentage of DHA plus EPA in the red blood cell membrane. So low risk group is greater than 8%. A therapeutic index greater than 5.5 is considered good, but why would you want to be good when you can be optimal? And I shoot for 10%. So about 1 gram of EPA plus DHA will raise your omega-3 index by about 1.5%. So if you're down there in that 4 category, you need to gain 6%, right? Well, if 1 gram raises it by 1.5%, that means you're going to need 4 grams to get up to that 10%. So I would just put them on 4 grams, leave them on 4 extra grams, about 3 months, and then I would recheck. So regular consumption of omega-3 fatty acids, particularly the EPA and DHA intake, will be reflected in an increase in your RBC omega-3 levels. So again, how long should you be on fish oil? Well, to raise your omega-3 index, you need a certain amount, and you need to change the diet in order to be able to decrease the dose of omega-3s. So what's the foundational response? Again, let's go on to the L-glutamine. So L-glutamine is a preferred fuel source for enterocytes of the small intestine. It increases intestinal villus height. It stimulates gut mucosal cellular proliferation. It maintains mucosal integrity, and it prevents hyperpermeability and translocation of bacterial factors such as lipopolysaccharides. So the gastrointestinal tract is by far the greatest utilizer of glutamine. Glutamine-enriched TPN, total parenteral nutrition, decreased villus atrophy and increased jejunal weight and decreased internal intestinal permeability. And in a clinical study of ulcerative colitis, 30 grams a day of glutamine for 4 weeks significantly improved both endoscopic and clinical endpoints independent of disease state. In other words, independent of if it was stable or active disease. And of course, because this was a single nutrient intervention, when they stopped the nutrient, they got bad again, right? But we're not doing that. We're doing a 5R program. So we're getting them stable using things like glutamine and vitamin D and fish oil, but then we're modifying the diet and lifestyle to maintain their improvement. And sometimes part of maintaining their improvement is keeping them on maybe not 30 grams of glutamine a day, but maybe just a few grams a day. So what doses? It depends on what you're trying to treat. You know, if you're just trying to heal a wound or improve general intestinal support, maybe just a couple of grams a day. If you've got somebody who's critically ill or has inflammatory bowel disease, you may want to use 10, 20, 30, or even 40 grams a day. So the GI repair and healing, we're talking about addition of a bunch of nutrients like we've already talked about, right? But particularly arginine, zinc, pantothenic acid, and various antioxidants. Also, we want to help the gut mucosal lining. So phosphatidylcholine. Phosphatidylcholine is an important factor for maintaining an intact barrier function in the gut. It also helps protect the mucin and mucus. A lack of phosphatidylcholine or PC can result in the reduction of hydrophobicity, which is part of the barrier function just from a chemical point of view. It alters TNF alpha and other signaling pathways such as NF-kappa B, and it's been found to substantially reduce it's substantially reduced in people with ulcerative colitis, but not so much with Crohn's disease. So again, mucus protectants like these polysaccharides are really important. They act as part of the barrier function. They lower bacterial adherence, and they lower bacterial invasion and translocation of things like lipopolysaccharides. And the same with the phosphatidylcholine products. So protecting the gut, we talked about lactoferrin, we talked about lactoperoxides, we've talked about whey immune globulins. Don't forget colostrum, serum-derived bovine immune globulins, or even egg-derived immune globulins. So we have a number of options. You know, what I find, I like to use colostrum, but when you're putting somebody on an elimination diet and they're not allowed to have dairy products, and then you give them colostrum, even though colostrum doesn't generally contain the antigens we're trying to eliminate by eliminating dairy, it's an uphill argument to make with your patient. So we have these other options for getting immune globulins into the system. Here is a study that talked about 3-cohort study evaluating TGF beta enriched formula in patients with Crohn's disease. So after being on this special formula for 8 weeks, they had improved sedimentation rate and C-reactive protein levels. Their serum albumin levels improved. Mucosal healing and disease activity was improved. And their serum IL-1 beta, IL-8, and IFN gamma all improved. And there was remission in both clinically and endoscopically was achieved. So these food-derived nutrients, these food-derived entities can be very powerful. And when we start stacking one on top of the other, these kinds of interventions, along with the rest of the 5R and the vitamin D and all the things we've talked about, we are able to get people off of their biologics for Crohn's disease and ulcerative colitis, and we can help them with their irritable bowel syndrome. It's very powerful. So here are some references to this TGF beta enriched formula. And what about these antioxidants? We talked about green tea and the catechins and how they have potent antioxidant and anti-inflammatory effects. We talked about curcumin and how curcumin is a wonderful systemic anti-inflammatory, but it's actually very poorly absorbed. So if it's good systemically, it's actually a lot better locally in the gut because there's a lot more of it there. And it's been found to help with ulcerative colitis maintenance therapy. So what about Joan here, right? What about Joan? Well, we certainly are going to be talking about some kind of nutritional support for her and some kind of anti-inflammatory support for her. So we've talked about putting her on her elimination diet. We've talked about the anti-parasitic protocol. We've talked about the pancreatic enzymes. We've talked about the pro and prebiotics. Let's also consider adding all of these other nutrients either as a medical food or as individual nutrients. There's nothing magic about a medical food. It's just a convenient way to get a lot of nutrients. So, whether you just add individually this sort of foundational gut support program or you choose a medical food, it doesn't really make any difference. So what does Joan need to rebalance? Well, let's go back to her matrix and take a look. And there's a lot of circles here, right? So just looking under triggers, we've got the divorce of her parents, which I suspect is still an unresolved trauma. We have her own divorce, which I suspect is an unresolved trauma. She has these 2 kids that have been very stressful for her to raise on her own, as it would be for anyone, right? She has depression. She has a stressful job and family dynamic. She has this pro-inflammatory diet. She has poor sleep, no exercise, very stressful lifestyle, and poor relationships. So lots of opportunities for intervention. So we want to think about modifying attitudes, beliefs, diet, lifestyle, so that the patient can promote a healthier way of living so that she does not relapse. So what does that look like? Well, we talked about this before, but scheduling, really important, right? If you don't pay yourself first, you'll never have a dime to your name. If you don't schedule yourself first, so you literally pick up your calendar and you say, me time. Now, it might say something other than me time, but it says something in there. Now you get a call and they say, hey, can you do such and such on so-and-so day? You know what? I'm sorry, I'm already booked. And you need to be definitive about that, because you can't be thinking, well, I'm supposed to be exercising that day. Oh, well, can't you just exercise later? No, I already have something booked. It's your time. So scheduling, mindful eating, better choices. So you could, as I said before, you could simply wait in line. I mean, I drive by McDonald's and there's a line all the way around the building. You could wait in that line, or you could drive to the supermarket, go only to the deli and get much higher quality food and go home with it. Or you could be prepared with frozen chicken breasts and frozen bags of vegetables. And if you really wanted to go crazy, you could have frozen organic chicken breasts and frozen organic vegetables, and you could make a quick stir fry shortly after getting home. There are other choices. So mindfulness, not only mindfulness eating, but mindfulness of preparation. Using techniques to get you out of fight or flight and into rest and digest. Heart rate variability, biofeedback, or brain entrainment devices. Some people who are already deeply in fight or flight find it very hard to use a biofeedback device, because the little light doesn't turn the right color, and instead of trying to relax into getting the right color, they go, oh, stupid light, it's not turning the right color. Well, that's not helping them get out of fight or flight. So sometimes in people who are really deeply into fight or flight, talking them through using a brain entrainment device. Sometimes the blinking lights and the sound in your ear is too activating for people who are already deep into fight or flight. And sometimes something like a PEMF device, a magnetic device, just entraining the brain with magnetic pulses, can be very soothing, because it doesn't have the blinking lights and the noise. It's just silent. And they can actually wear it when they're walking around. Then, as they get out of fight or flight, incorporating yoga or meditation or prayer or breathing or dance or other grounding activities, body awareness activities, psychotherapy as needed, improving neuroplasticity. So what kind of things might we do in this case? Certainly some things on this spectrum, right? But we need to be mindful in Joan's case and in all of our patients' case. We can't just layer more junk on top. We have to help her incorporate this into her already hectic lifestyle, right? We can't just pile on more stuff. So there's an excellent book I love. It's called First Things First. There's 3 authors. I can only remember one of them. His name is Stephen Covey. And he talks about the difference between important and urgent. And he actually makes a graph where he's got important and not important, and urgent and not urgent. And so there's 4 quadrants. And important and urgent, that's things like breathing, right? We got to do that. Then there's important and not urgent. That's self-care. That's vacations. That's recharging your batteries. But unfortunately, most of us are urgency addicts, and we're doing stuff that's urgent but not important, like responding to the ding on our phone from our social media, or just other time-wasting things. And his idea is, don't try to cram more stuff in your day, which is sort of the object of most time management, time efficiency programs. Instead, he says, no, don't do that. Take all of the time that you're wasting in urgent but unimportant, the urgent unimportant quadrant, and move it into the important but not urgent quadrant. So that's what rebalance is about. Letting go of the urgent but not important and moving that time into the important but not urgent quadrant. So here are some references for rebalance. So let's recap our 5R program. So we're going to do an elimination diet, and we're doing this for a variety of reasons, but primarily, as I said, it's the gold standard for finding food sensitivities of all kinds, whether it's an intolerance, a sensitivity, or an allergy. We found parasites on her test. We found blastocystis hominis, so we're going to treat her for that. We found low pancreatic elastase 1. We're going to treat her for that. we found dysbiosis, right? Multiple different ways we found dysbiosis. We found dysbiosis from her low short chain fatty acids, from what was growing in her gut. We found evidence of leaky gut because of her low pancreatic elastase. We're going to consider additional things to help heal her gut. So either a medical food or individual nutrients. And then my favorite thing, all of my patients get some kind of immune support because almost everybody has a deficient secretory immune globulin A, but even if they don't, it's going to help us in a more specific way manage the dysbiosis, because these immune globulin products made by bovine of some kind, or pigs or whatever, or eggs, they generally don't make antibodies against probiotic species. They tend to make more concentrations of immune globulins, is what I meant to say. They tend to make more immune globulins against less desirable bacteria. So you're sort of selectively inhibiting the less desirable bacteria and facilitating the growth of the good bacteria, because two reasons: the immune globulin is not inhibiting them and the prebiotics are supporting them. And then rebalance. So what does that mean, rebalance? Well, it means changing the diet so that we can let go of some of these supplements over time. It means increasing the omega-3 fatty acids. It means increasing the prebiotics in the diet so that we don't need those as supplements anymore. It means improving the relaxation response. It means reducing the fight or flight and improving and increasing the rest and digest. It means all of these things to normalize physiology. And then psycho-emotional impacts on the microbiome. Stress suppresses lactobacillus and bifidobacterium and secretory immune globulin A. Catecholamines stimulate the growth of gram-negative organisms. And don't forget that at least half, somewhere in the vicinity of half of all the norepinephrine produced in your body is produced in your gut. So, we talk about gut feeling, right? And we will talk more, I'm sure, in this program and previously about the second brain and the gut the gut nervous system, and how all of the neurotransmitters that are active in your brain are active in your gut. And so if you're producing a lot of norepinephrine in your gut, it's a hormone, right? And it's going to be effective systemically as well. And fear and anger increase Bacteroides fragilis. And here are some references surrounding that. And what we're really trying to do is think about pattern recognition. Pattern recognition. This is a complex web. And as Dr. Hanaway pointed out, we learn this very clean little pattern of the Krebs cycle, but that clean little circle fits into a much larger and much more complex web, right? And this web isn't just complex, it displays complexity, which implies chaos, which means that just because we understand the starting circumstance doesn't mean that we can predict the outcome. And so that is why we need these much more complex interactions in these dietary interventions, because just giving this nutrient doesn't guarantee that we'll have this outcome. Instead, we need to have a robust set of inputs that guide the complexity in the direction and nudge it and coax it and coerce it into a direction of wellness. So it's a wonderful feeling to recognize the unity of complex phenomena that, to direct observation, appear quite separate things, right? But instead, they are more complex and interactive. So keep an open mind, but not so open as to let your brains fall out. And remember, unless there is a compelling reason to do otherwise. Start in the gut. Now, don't treat the gut exclusively. Don't get trapped in the gut, but instead use it as a very important starting place and a very big leverage point. But remember the rest of the matrix. Remember all of the antecedents, triggers, mediators. Remember the modifiable lifestyle pieces. But the gut is the place to start because the gut is a central node in the complex web that is functional medicine. And remember that the gut is not just an inert tube. The gut is helping us digest and absorb. Intestinal permeability is the way we keep the outside world out and let the nutrients in. But when that goes haywire, we get abnormal interactions between the gut luminal content and our immune system, and that can lead to upregulated inflammation all the way to and including autoimmunity. The gut microflora, the microbiome, is critical for the development of the enteric nervous system and the immune system. The immune system is regulated by the gut microbiome to some degree, and inflammation and detoxification are modulated by the gut microbiome. And there's this intimate relationship between the microbiome and the gut enteric nervous system. And all of this is critical for the well-being of our patients. And then remember our 5R scaffold for building these complex, personalized interventions. Remove the bad stuff, replace with good stuff, re-inoculate, meaning build an environment that creates a robust, diverse, teeming ecology within our bodies of these microorganisms. Provide nutrients for repair and help the patient rebalance the totality of their lifestyle and life to support health. And remember that these are not steps. It's not step one, remove, and then step two, replace. It's remove, replace, reinoculate, repair, rebalance in layers. A little bit of each one, maybe more remove and a little bit of the others, and then a little more replace and some of the others, and then maybe more inoculation, but keeping all the others, but not one, not remove and then replace and then repair, but all and a little more and a little more and a little more as you need to, always baby stepping the rebalance, starting with baby steps of rebalance on the very first intervention, and then getting, as time goes on, to the much more complex rebalances of finding those deep hidden traumas or those difficult to change dietary habits. And remember that it's really just these 5 basic questions. What are we going to remove? What are we going to replace? How are we going to create this robust, diverse microbiome? What does this patient need to optimally repair? And how are we going to help them rebalance? We're going to help them figure out which foods to remove because of sensitivities, intolerances, and allergies. We're going to look for imbalanced and pathogenic microflora. We're going to look for environmental stressors, and we're going to look for psychological stressors. And that's going to potentially look like an elimination diet and some kind of antimicrobial and some kind of removal of toxins and stressors. And replacement. We're looking to replace digestive factors, whether it's hydrochloric acid or bile acid or pancreatic enzymes or fiber or other digestive factors. And reinoculate really means creating a diverse, robust dietary approach with lots of prebiotic foods and probiotics as placeholders, and guiding and nurturing this rainforest within us of the microbiome, trying to create this robust ecological system. And we're going to do that with probiotics, which are really just placeholders, remember. And we're going to do this with prebiotics, and we may mix them together, which are called symbiotics. but we're going to do it in a way that really creates diversity and robustness and resilience. And then we're going to make sure that they have, not in, and then, but in addition and at the same time, we're going to make sure that they have robust amounts of nutrients necessary for repair. And remember that it's a lot of stuff, right? It's a full complement of all of the nutrients, plus specialized things like phosphatidylcholine or plantain or polysaccharides, or support for the GALT, which might include lactoferrin or lactoperoxide or all of these immune globulin products I previously discussed, or specific antioxidants known to be very active in the gut, or anti-inflammatories known to be very active in the gut. And then rebalance. Once again, if you don't schedule yourself, you'll never have a moment to yourself. Mindfulness of preparation for your foods, mindfulness during eating, some kind of alteration of your autonomic balance away from fight or flight and towards rest and digest. And in the most ill, it might be hard to do a biofeedback technique. You might want to talk to them about using a brain entrainment technique, and then graduating to a biofeedback technique, and then graduating to yoga and meditation and prayer and breathing and movement meditations. And then maybe they need psychotherapy to help them through some of these deep-seated issues, whether it's food cravings or traumas that they hold. And you know, it's never one or the other. It's always yes and. It's about balance. The microbes are clearly important. So I don't believe that the microbes are nothing. But clearly the terrain is critically important and often overlooked. And it is through managing the terrain with the dig in and 5R approaches added to the go to it model that allows us to deeply and very individually personalize therapies for people with issues surrounding the assimilation node. But remember that the assimilation node impacts everything within the functional medicine matrix. So thank you so much for your attention today. And it's been a pleasure being allowed to participate.